Hello, good morning, all of you. Today I will discuss about the subject of pathophysiology and topic is gastrointestinal system like peptic ulcer. First of all, today I will discuss the learning objectives of peptic ulcer. Learning objectives of peptic ulcer based on the content in this chapter. The reader should be able to like definition and introduction of peptic ulcer and causes of peptic ulcer, and third one objective is sign and symptoms of peptic ulcer, and fourth one objective is pathophysiology of peptic ulcer, and fifth one learning objective is comparison between gastric and duodenal ulcer, and sixth one objective is management of peptic ulcer, and last one objective is complications of peptic ulcers. During the peptic ulcer disease, many types of complications seen. Next one, learning outcomes. What are the learning outcomes of peptic ulcer? By the end of the lecture, the student should be able to understand. And first one learning outcome is peptic ulcer, definition and introduction of peptic ulcer, causes of peptic ulcer, and third one outcome is sign and symptoms of peptic ulcer, and fourth one learning outcome is pathophysiology of peptic ulcer, and fifth one, learning outcome is comparison between gastric and duodenal ulcer. And sixth one, learning outcome is management of peptic ulcer. And last one, learning outcome is complications of peptic ulcer. Complications of peptic ulcer. Next one. First one, discuss about the introduction of peptic ulcer. A peptic ulcer is loss of tissue from the lining of the digestive tract, in which peptic ulcer the tissues loss of tissues from the lining of the digestive tract, and normally a mucus barrier protect the lining from the digestive fluid, in which digestive tract mucus barrier protect from the digestive fluid, and when the barrier fails when the barriers fails, like pepsin and hydrochloride injuries the unprotected tissues, in which gastrointestinal tracts pepsin and hydrochloric acid injure the unprotected tissues. Next one, anatomy review of digestive tract and gastrointestinal tract. First one is starting is mouth, and next one part of digestive tract is tongue, and next one part is esophagus, stomach, duodenum, small bowel, large bowel, and anus. These are the anatomy of GIT tract. Next one, definition. Definition of peptic ulcer. This is the erosion. This is the erosion of gastrointestinal mucosa. This is the erosion of the gastrointestinal mucosa resulting from the digestive action of hydrochloric acid and pepsin. These are the digestive fluid in which stomach like hydrochloric acid, pepsin, renin, and mucin. These are the digestive fluids present in the digestive tract and stomach. This is the erosion of the gastrointestinal mucosa resulting from the digestive action of hydrochloric acid and pepsin. Erosions occurs when the mucous membrane lining the stomach becomes inflamed. Means erosion, inflammation of mucosa membrane lining in the stomach. And next one, It is a break in continuity. It is a break in the continuity of the GIT. It is a break in the continuity of the GIT that may involve the mucosa, submucosa, and muscle layer of esophagus, stomach, and duodenum. The breakdown of continuity of GIT that may involve the mucosa, submucosa, and muscle layer of muscular layer of esophagus, stomach, and duodenum. Next one, causes of peptic ulcer. Causes of peptic ulcer. Peptic ulcer can be classified according to duration as well as location. The classification of peptic ulcer based on the duration as well as location of the tract, digestive tract. Next one is according to duration. According to duration, there is acute and chronic ulcers. According to duration was the acute peptic ulcers and chronic peptic ulcers. Next one is the cause is unknown. However, there are predisposing factors, and this includes like regular and prolonged use of non-steroidal anti-inflammatory drugs like aspirin. The predisposing factors, and these includes like regular and prolonged use of NSAIDs means non-steroidal anti-inflammatory drugs like aspirin. Aspirin causes the peptic ulcer. And next one is excessive regular alcohol consumptions. Excessive regular alcohol consumptions and heavy cigarette smoking. Excessive regular alcohol consumptions and heavy cigarette smoking, which may accelerate gastric acid production, in which GIT, excessive regular alcohol consumptions and heavy cigarette smoking, which may accelerate gastric acid production and cause the peptic ulcer. Next one is infection with Helicobacter pylori. Next one causes infection with Helicobacter pylori, and Helicobacter pylori bacteria cause the peptic ulcer in stomach and duodenum colon. Next one is pathologic hypersecretory state. Pathologic hypersecretory states such as Zollinger-Ellison syndrome. Pathologic hypersecretory states such as Zollinger-Ellison syndrome. Zollinger, what is Zollinger-Ellison syndrome? Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is a condition in which one or more tumors from your pancreas or the upper part of your small intestine like duodenum, and these tumors cause gastromas. Gastriomas. These tumors cause gastriomas and secrete large amount of hormones like gastrin, which cause your stomach produce too much acid. This is the Zollinger-Ellison syndrome. Next one, pathophysiology. Pathophysiology of peptic ulcer. What are the pathophysiology of peptic ulcer? The first one is the mechanism of mucosal injury. The mechanism of mucosal injury in gastritis and PUD are through the through to be imbalance of aggressive factors such as acid production and production of pepsin, and defensive factors such as mucus production and bicarbonate and blood flow. These are the defensive factors of digestive tract, GI, gastrointestinal tract. First one is PUD means peptic ulcer disease, and gastritis. Gastritis means inflammation in gastric intestinal tract. Next one is erosive gastritis. Erosive gastritis. Erosive gastritis usually is associated with serious illness or with various drugs like stress, bile, ethanol, and non-steroidal anti-inflammatory drugs disrupt the gastric mucosal barrier, making it vulnerable to breakdown forming ulcerations. Erosive gastritis usually is associated with serious illness like with various drugs like stress, bile, ethanol, and non-steroidal anti-inflammatory drugs, and disrupt the gastric mucosal barriers, making it's vulnerable to breakdown forming ulcerations. Next one is infection with infection, gast- erosive gastritis, any of a group of condition in which the stomach lining is inflamed, and cause include infections like injury, regular use of pain pills called non-steroidal anti-inflammatory drugs, and too much alcohol. Next one is infection with Helicobacter pylori. Infection with Helicobacter pylori is the leading factor. Helicobacter pylori is the leading factor in peptic ulcer disease formation and is associated with all ulcer not induced by non-steroidal anti-inflammatory drugs. This is the pathophysiology of peptic ulcer. Next one, the pylori. The pylori colonize the deep layer of the mucosal gel that supports the gastric mucosa and disrupts its protective properties. Disrupts its protective properties. Colonize means pylori colonize means by various bacteria resulting in significantly impaired healing epidermal growth factors like IGF. Epidermal growth factor is capable to preventing bacterial colonization of the healthy intestinal mucosa, and the non-steroidal anti-inflammatory drugs also interfere with the protective mucosa layer. Non-steroidal anti-inflammatory drugs also interfere with the protective mucosa layer by inhibiting mucosal activity. By inhibiting mucosal activity and reducing mucosal prostaglandins, which cause abnormal permeability of the mucosal layer. The non-steroidal anti-inflammatory drugs also interfere the protective mucosal layer by inhibiting mucosal activity and reducing mucosal prostaglandins, which cause abnormal permeability of the mucous layer. Next one is the common site. The common sites where ulceration occurs are duodenum, antrum, laser curvature, and gastroesophageal junction. Gastroesophageal junction. Laser curvature. Laser curvature, the boundary of the stomach. Laser curvature is the boundary of the stomach that in human from a relatively short concave curve on the right from the opening of the esophagus to the opening in the duodenum compare greater curvature. Next one is gastroesophageal junction. Gastroesophageal junction, which is defined as the gastroesophageal junction, in which is defined as the point where the distal esophagus join the proximal stomach and is the short and term anatomic arc that is commonly is exposed to injuries effect of the gut. Gastroesophageal reflux disease of H. pylori. Next one is, this is the location of many types of ulcers like esophagus ulcers, esophagus in which esophagus, and stomach ulcers like gastric ulcers, duodenal ulcers in small intestines. These are the locations of duodenal ulcers. Next one, sign and symptoms of peptic ulcer. Sign and symptoms of peptic ulcer, like epigastric pain. Epigastric pain, which is burning and relieved by food or antacids. Epigastric pain, which is burning and relieved by food or antacids like duodenal ulcers, or dull pain and not usually relieved by food and antacids means gastric ulcers, in which duodenal ulcers are relieved by food and antacids, but gastric ulcers are not relieved by food and antacids. Next one is persisting persisting vomiting due to pyloric stenosis and acid regressions. Acid regressions, pyloric stenosis. Pyloric stenosis, a condition in which the opening between the stomach and small intestine thickness. A condition in which the opening between the stomach and small intestine thickness. Next one is nausea, vomiting, and anorexia. These are the signs and symptoms of peptic ulcers like nausea, vomiting, and anorexia, in which common in gastric ulcers, common in gastric ulcers due to vagus nerve which stimulate the hypothalamus. Vagus nerve is stimulated by the hypothalamus and consequently the vomiting center and consequently the vomiting center. Dyspepsia. Dyspepsia, indigestion in dyspepsia. Acid regurgitations. Acid regurgitations means acid reflux happen when content from your stomach move up into your esophagus. It's called acid regressions. And next one is dyspepsia, indigestion, and heartburn due to regurgitation of gastric content. Dyspepsia, indigestion means upper abdominal discomfort. Dyspepsia, dyspepsia indigestion means upper abdominal discomforts, describe and burning sensation. Describe and burning sensation like bloating of gases and nausea and feelings full the food quickly after starting food. It means dyspepsia. Next one, oc- occult blood in stool. Occult blood stool due to bleeding from a perforated ulcer. Occult blood in stool due to bleeding from a perforated ulcers. Occult blood means the groups can see it's with the naked eye. Blood in the stool means that likely some kinds of bleeding in digestive tracts means occult blood in stools due to the bleeding from a perforated ulcers. Next one is weight loss due to weight loss due to painful gastric ulcerations. Weight loss due to painful gastric ulceration which occurs soon after eating food. But there is weight gain in duodenal ulcers because pain is relieved by food intake. Next one is hematomesis. Hematomesis and melena. Hematomesis means vomiting of vomiting of a stomach content mixed with blood or the regression of blood means hematomesis. Hematomesis means vomiting of stomach content mixed with blood or the regression of the blood only. Next one is melania. Melania means the production of dark sticky pieces. The production of dark sticky the production of dark sticky pieces containing partially digested blood as a result in internal bleeding or the swelling of blood. Next one, anemia, perforated ulcers. Perforated ulcers. Anemia may be present in chronic peptic ulcers. Anemia may be present in chronic peptic ulcers cases due to hemorrhage from perforated ulcers and poor nutrition. Due to perforated ulcers and poor nutrition cause the anemia may be present in chronic peptic ulcers cases. Next one, comparison between gastric and duodenal ulcers. Comparison between gastric and duodenal ulcers. The comparison between gastric ulcer and duodenal ulcer, in which gastric ulcer like location is stomach and gastric and is common in age 50 years and above, and duodenal ulcer location is duodenum and it's common in age 30 to 60 years, and gastric ulcers there is normal or hypersecretion of acid. Gastric ulcer are caused by the normal or hyposecretion of acids, and duodenal ulcers are caused by the hypersecretion of stomach acids, and gastric ulcers are cause the weight loss, and duodenal ulcers are cause the weight gain. Pain occurs immediately 30 to 60 minutes after meal, barely occurs at night in gastric ulcer, and pain occurs 2 to 4 hours after meals, usually occurs at night means duodenal ulcer, and in ingestion of foods aggressive pain, in which gastric ulcer, and in which duodenal ulcer ingestion of food relief pains. Next one is gastric ulcer was the in which gastric ulcer vomiting is common, and in which duodenal ulcer vomiting is rarely, and in which gastric ulcer hemorrhage is common, often leads to hematomesis and melena, and in which duodenal ulcer hemorrhage is rare. That are the This is the comparison between gastric ulcer and duodenal ulcer. Next one, management. Management of management of peptic ulcer. First one is investigation. Investigation of peptic ulcer, like history taking, like history taking, perforated ulcers. Perforated ulcer, perforated ulcer is a condition in which an untreated ulcer has burned through the mucosal wall in a segment of the gastrointestinal tract, like stomach and colon, and allowing gastric content to click in the abdominal cavity. Next one is physical examination and special radiology, in which radiology use the barium meal is done to visualize the ulcers. Barium meal are used in the radiology to the visualize the ulcer after the the patient has taken the barium sulfate. And next one is gastroscopy. Next one is gastroscopy and duodenoscopy to observe the mucosa. Gastroscopy and duodenoscopy to observe the mucosa. First one is gastroscopy, in which gastroscopy is a procedure where a thin flexible tube called an endoscope is used to look inside the esophagus and stomach and first part of the small intestine means duodenum. This is the gastroscopy, and next one is duodenoscopy, in which duodenoscopy is a procedure where is a thin flexible tube called an endoscope and used to look inside the small intestine means duodenum. Next one is biopsy. Biopsy may be done for gastric ulcer to diagnose big or malignant changes. Biopsy is a simple of Biopsy is a sample of tissue taken from the body in order to examine it more closely. for the identification of disease. Next one is next one is stool examination. Next one is stool examination to detect presence of blood, occludes or trace in stool, which may be a sign of bleeding from the gut. And next one is gastric juice and analysis. Gastric juice analysis. Next one, management treatment, medical treatment. Medical treatment, one aspect of treating one aspect of treating peptic ulcer. One aspect of treating peptic ulcer is neutralizing or decreasing stomach activity by the neutralizing of peptic ulcer and decreasing stomach activity to treat the peptic ulcers. This process this process begins with eliminating possible stomach irritants such as non-steroidal anti-inflammatory drugs like alcohol, non-steroidal anti-inflammatory drugs and alcohol and nicotines. These are the cause stomach irritants. So eliminate the non-steroidal anti-inflammatory drugs and alcohol and nicotine. Next one, although blend diet may have a place in the treatment of ulcer, all the blend diet may have a place in the treatment of ulcer, and no strong evidence support the belief that such diets speed healing or keep ulcer from recurring. Nevertheless, people should avoid food that seem to make pain or bloating worse. Blend diet. Blended diet means includes food that are soft, not very spicy, and low in fibers. If you are one a blend diet. Next one is blotting. Next one is blotting worse. Blotting worse is a inflammation of the digestive tract. Blotting worse is inflammation of the digestive tract. Next one is barium sulfate. Barium sulfate is used to help doctor examine the esophagus like tube that connect the mouth and the stomach and intestine using X-ray and computed tomography CT scans. Next one, aim of treatment. Aim of treatment of the peptic ulcer to relieve discomforts, and protection of mucosa barrier to promote healing. Protection of mucosa barrier to promote healing and prevention of complications and recurrence. These are the aim of treatment of peptic ulcer. Next one, the aim can be achieved through the use of drugs. The aim can be achieved through the use of drugs such as antacids, H2 receptor antagonists, proton pump inhibitors, and analgesia and antibiotics. These drugs treat the peptic ulcers. Next one is antacids. Antacids like magnesium trisilicate. Magnesium trisilicate used as a antacids and reduce the pH of the stomach and presentation. Tablet of magnesium sulfate is 2 250 mg and 500 mg. Doses adults 250 to 500 mg chewed 8 hours sleep or PRN. Pro-Re nectar. PRN means as per needed. Side effects like diarrhea. Diarrhea is the side effect of magnesium trisilicate and precautions to be taken with caution in patients with renal impairments to be taken with caution in patients with renal impairment. Next one, H2 receptor antagonist. H2 receptor antagonist. These H2 receptor antagonists inhibit the action of histamine. H2 receptor antagonist inhibit the action of histamine on the parietal cells, thereby inhibit the secretion of acid. The H2 receptor antagonists inhibit the action of histamine on the parietal cells and thereby the secretion of acid. An example of antagonists Example of H2 receptor antagonist is cimetidine. Cimetidine, ranitidine, these are the H2 receptor antagonists. And presentation tablets 200 mg to 200 mg, 400 mg, and injectables 100 mg per ml and 150 mg per ml. This is the presentation and doses 20 to 30 mg per kg body weight is divided doses and side effects of H2 receptor antagonists like alopsia, confusion, dizziness, and impotence, peripheral neuropathy. These are the side effects of H2 receptor antagonist drugs. And next one is persons avoids intravenous injections, particularly in high dose and cardiovascular impairment. These are the precautions of H2 receptor antagonist during the therapy of H2 receptor antagonist. Next one, proton pump inhibitors. Proton pump inhibitors. An example is omeprazole, and another name is Prilosec. Omeprazole is another name is Prilosec. Omeprazole, another name is Prilosec, and presentation capsule is 20 mg and doses 20 mg orally, 6 orally for 4 to 6 weeks. And pediatric dose is not established. Proton pump inhibitor Proton pump inhibitor pediatric dose is not established, and side effects of proton pump inhibitors like headache, dizziness, diarrhea, abdominal pain, vomiting, flatulence, rashes, back pain. These are the side effects of proton pump inhibitors. Next one is antibiotics are increasingly antibiotics are increasingly being used when the bacterium Helicobacter pylori is the underlying cause of peptic ulcer. Antibiotics are increasingly being used when the bacterium Helicobacter pylori is the underlying cause of peptic ulcer. Next one, metronidazole, amoxicillin, or tetracycline is commonly used in the treatment of Helicobacter pylori cause peptic ulcers. And analgesic for pain may be prescribed Panadol. Analgesic for pain may be prescribed Panadol in peptic ulcer pain. Next one. Next one, complications. Complications during the therapy of peptic ulcers like during the treatment of peptic ulcers like hemorrhage in which hemorrhage resulting from excessive erosion of blood vessels in the GIT, in which hemorrhage resulting from excessive erosion of blood vessels in the GIT was the hemorrhage, and the next one is perforation. Next one is perforation, in which perforation due to continuous erosion of mucosa. Due to continuous erosion of mucosa of the stomach and or duodenum, a peptic ulcer may perforate through into the peritoneal cavity and cause acute abdomen. Next one is pyloric obstructions. Pyloric obstructions in which occurs distal to the pyloric sphincter as a result of edema of the inflammatory tissues or due to scarring of the previous ulcers. And last one complications is malignant changes. Malignant changes resulting from the chronicity of the ulcers. Malignant changes are occurs during resulting from the chronicity of the ulcers. These are the complications of peptic ulcer. Next one, references. First one reference is Clinical Pharmacy, 10th edition 2010 by P. N. Bennett. And second one reference is Clinical Pharmacy and Therapeutic, 5th September 2011 by Roger Walker, Kate Iglesias. And third one reference is Pharmacotherapy, Pathophysiology Approaches, Pro 7th editions. And fourth one reference is Essential of Medical Pharmacology, Credit Tripathi, 5th editions. And fifth one reference is Basic and Clinical Pharmacology, Bertram G. Kupchak's 11th edition. And sixth one reference is Rangendel Pharmacology, 6th edition. And last one reference is Pharmacology and Pharmacotherapeutics, Sotaka, 20th edition. That are the references regarding to the peptic ulcer. Next one, multiple choice questions regarding this topic. First one question is which of the following receptor? Which of the following receptors is closed by drug during a peptic ulcer? Option A is H1 receptors, option B H2 receptors, and option C proton pump receptors, and option D H1 and proton pump receptors. The right answer is D. H1 and proton pump receptors are closed during the drug during a peptic ulcers. Next one question. Next one question. Which of the following drugs are ulcer protective? Which of the following drugs are ulcer protective? Option A is famotidine. Option B is omeprazole. Option C is sucralfate. And option D is misoprostol. The right answer is C. Sucralfate are drug used as a ulcer protective. Next one question. All are true about amoebic ulcer accepts. All are true about amoebic ulcer accepts. Option A is flask septal ulcers. Option B commonest site in ascending colon and ostium. And option C is perforation is common. And option D is paucity of inflammatory cells. The right answer is C. Perforation is common about amoebic ulcers, except next one question. Transverse ulcers are seen in. Transverse ulcers are seen in option A is typhoid, option B is amoebiasis, option C is tuberculosis, and option D is ulcerative colitis. Ulcerative colitis. The right answer is C. During the tuberculosis, transverse ulcers are seen in tuberculosis. Next one question. Aqueous ulcers are also known as aqueous ulcers are also known as option A is canker sores, option B Marzol Marzoligen ulcers, next option C is curling ulcers, and option D Cushing ulcers. The right answer is A canker sores. Next one question. All are complications of typhoid ulcer except all are complications of typhoid ulcer except option A is perforation, option B is structure formation, and option C hemorrhage, and option D is sepsis. The right answer is B. Structure formation is a complication of typhoid ulcer except. Next one question. The most ulcers are due to result of Mycobacterium pylori. Option A is true and option B is false. The right answer is true. Most ulcers are due to the results of Mycobacterium pylori. Next one question. Which of the following correctly defines which of the following correctly defines as peptic ulcers? Option A is when the esophagus start getting thinner. Option B, a beginning lesion of gastric mucosa. Option C, both A and B. And option D, none of the above. The right answer is B, a beginning lesion of gastric mucosa. Next one question. Which of the following drug is an antacid? Which of the following drug is an antacid? Option A is cimetidine. Option B, omeprazole. Option C, magnesium hydroxide. And option D, misoprostol. The right answer is C, magnesium hydroxide drug is an antacid. Next one question. What are causes of GERD? Gastroesophageal reflux disease, gastrointestinal esophageal reflux disease. Option A is overproduction of acid. Option B, over-relaxation of lower esophageal sphincter. And option C, both A and B. And option D, none of the above. The right answer is C, both A and B. Overproduction of acid and over-relaxation of lower esophageal sphincter is the cause of GERD, gastroesophageal reflux, gastrointestinal esophageal reflux disease. These are the MCQ questions of this topic. Next one is thank you. Thank you all of you for a wonderful session.